Good morning. My name is Sarah, and this is a public service announcement regarding the benefits of breastfeeding. This is Miss Soledad Reyes. She is my patient for today. She just delivered a baby girl. And I've been meaning to ask you, have you decided whether you want to breast or bottle feed?
I will be doing both.
Oh, well, I'm happy to hear that. Do you have other children?
No, this is my first baby.
This is your first baby. Okay, well, the way breastfeeding works, kind of, is that we need to establish breastfeeding in order to bring your milk in. And I mean, I am totally behind you on whatever you decide to do, but while you're here, it would be best if we try to establish as much breastfeeding as we can, and that way there's many people around that can help you. Okay? Let me go over some benefits with you. If we start with breastfeeding and we try to get the baby to breastfeed as much as possible, they get that colostrum. And colostrum is that first part that looks kind of like a honey discharge that comes out of your breast, and it is full of nutrients and antibodies to help your baby in the first couple days of life. And it's designed to just be the right amount. And I know you feel like you're just exhausted and your baby's not getting enough. It's a common risk that comes along with breastfeeding, as you never feel like your baby's getting enough because they're just always on you, always wanting to eat. And I just want to remind you and let you know, this is normal behavior for your newborn. The colostrum is only designed to fill up the baby's stomach, which is only about this big, only halfway, because the more they stimulate the breast, the more milk will produce. And your breast milk will actually come in 3 days, and that'll be a lot. And then they won't be doing that cluster feeding as often. So they're doing what they're supposed to be doing. And the other thing about colostrum is it really absorbs quickly in the baby. And breast milk in general just digests so much faster because it's absolutely the most perfect ingredient for the baby. Whatever comes out of you is exactly what the baby needs. So if it's because it's actually chemically formulated just for your baby, there's no waste. Your baby just gets bigger and healthier. Okay? And that's the difference between bottle feeding and breastfeeding. Bottle feeding, about probably 75% of that is actually going to not be digested completely by the baby and will be basically pooped out. Okay? Whereas breastfed babies, they only poop every 1, 2, or 3 days. So I don't want you to be alarmed if in a couple of days your baby hasn't pooped, because if breastfed babies, they don't really poop very much because they just get bigger. Okay? Any questions you might have regarding, has your baby had any episodes of spitting up or anything that I should be aware of?
No, the only thing is that I don't have to burp the baby, right?
No, actually, that's one of the benefits of breastfeeding as well, is your breasts, they don't have air like bottles. Bottles are just full of air, so the baby sucks air. But your breast, not so much. But if your baby does get a little bit of gas, sometimes, I mean, just like us, no matter what, we can get gas. You just burp the baby in between, but if the baby's asleep, the baby's asleep. They're content, no need.
Okay. And then how often do I feed my baby?
As often as your baby wants. See where your baby's living right now? That's her favorite place on earth right now, because before she was inside of you, and all she knows is your smell and your heart rate, and that is the closest place that she can find it. So she will let you know, and you know, they have signs, they have rooting, they suck on their hands, they're looking for it. They are very clear about their needs of wanting to eat.
Other than you said that there's antibodies and nutrients for the baby, is there any other benefits to breastfeeding?
Oh yes, the pH is exactly what the baby. I mean, your pH of your breast milk is the exact formation of what the baby can tolerate in their stomach. That's why very rarely do babies have any allergies or problems with breast milk as compared to formula. Because formula has a different pH and it could wreck the lining of the baby's stomach. So, I mean, it's basically just like I said, what you make, what comes out, doesn't it make sense that what the baby's been used to has been your body?
Yeah.
So what comes out of your body is going to be safe for your baby.
Okay.
Also, if you were to get sick, your body creates antibodies for you as you're getting sick to basically fight whatever you're sick from. And you're passing those antibodies to your baby as your body's making them. So everybody feels like, oh no, I can't breastfeed because I'll get the baby sick. And that's not true. You're only passing good. You're not passing bad. Because you can coughing and sneezing and whatever, and that can get on. But the baby is not going to get very sick, if at all, because they're getting all of your immunities through the breast milk.
Okay.
All right.
Any other benefits that I can be aware of?
There's so many benefits to breastfeeding. Breastfeeding has been known to have a decreased chance for your baby to have a childhood obesity. There has been studies to find that breastfed babies have healthier teeth, less likely to get sick, less likely to be hospitalized. I can go on forever about the benefits of breastfeeding, but really, there's also lots of benefits for you. Well, you'll get back to your fighting weight pretty fast. All right, 500 calories a day it takes to breastfeed full time. Right? So that's all scrumptious good food that you can be eating and not gaining any weight. Or, if you want to eat really good food, which is like leafy green vegetables, lean meats, which is what you want your baby to eat anyway, because, you don't want to fill your baby full of junk. Then it takes a lot more food to do that if you're eating healthy. So, you will lose weight and your uterus will contract much, much faster down to its regular size.
Yeah.
And you lose weight pretty quickly and you look skinny again.
Well, I've noticed that, like, when I feed the baby, my uterus contracts.
Yeah, that's normal. That's like cramps from having your menstrual cycle and stuff. Very normal. And good. It's a good sign. And also, it'll decrease your bleeding. Yeah, so it's all the way Mother Nature works and all helpful things for you.
Wow, thank you.
All right.
Okay.
So, is there any other questions you may have at this time?
No, I think I'd rather breastfeed here than bottle feed. If that's all what it's gonna do.
It's gonna do it. I guarantee you. All right. Okay. Thank you.